a person from very famous family from this Tamil Nadu, a place called Nagambatti, a small village. He born with a silver spoon. And he studied in medical college. On those days, he will go by car while he was studying. So he is very fortunate. And his father only founded Cardiology Block in Government General Hospital in Chennai. On top of that, almost 90% of the cardiologists available all over India are the student of our beloved Dr.S Ranjan. As rightly said by Professor, he is a pioneer, pillar of Vasupal's creation. Now, with your thundering applause, I invite Dr.S Ranjan, Double Diamond, MD/DM, Cardiology, to talk about Ganoderma lucidum and ancient herb in modern medicine.
Just a brush up on Ganoderma. I know that you are all experts in Ganoderma. So nothing more to add to that, information. All of you know that Dr. Lim started this company with just one product, RGGL. And today we have more than 80-85 products in Malaysia. In India we have about 18 to 19 products. But the base product remains Ganoderma. So just to brush up our knowledge on Ganoderma, I will shorten my lecture to 30 to 40 minutes because after that you have a big felicitation function to felicitate all our guests. So talking about Vasupal creation, few years back when we were discussing, myself and Professor, I was telling him that he must do something for teaching and training DXN members, because in every system the learning is a very important part. Then only we can grow. And when I put forward that idea, he started thinking very seriously, and he said, okay, we will create a forum for that, and that's how the Vasupal creation was born. And today Vasupal creation has given so many training programs. Every year he conducts this leadership camp, and is, as I said in my welcome address, is putting so much of time and energy and lot of money from his own, pocket to conduct this sort of a high international standard teaching program. So this, I'm sure this basically will educate a lot of people, especially young leaders who want to come up in life. So with that note, let me start my lecture. Of course, we belong to the allopathic system of medicine, and this is a very strong system of medicine which deals with various kinds of diseases. And allopathy is the system for any emergency situations. At the same time, it has a lot of limitations. We do not have much for prevention except vaccines. There is no drug for any prevention. So in that context, Ganoderma is a very powerful herb which gives us that power to protect us from various diseases. So today, the allopathic system primarily focuses on treating the diseases. But we have realized today that prevention is the key. And in prevention of diseases, most important factor being the nutrition. Now, we allopathic doctors realize that nutrition is very, very important. And we know that nutrition becomes a medicine. Because a lot of nutritional disorders leads to very many diseases, especially lifestyle diseases. And a lot of killer diseases are caused by lack of nutrition. And in DXN, we have a very powerful product, spirulina, which is the most nutritious food in the world. And these two products, can really help us in preventing a lot of diseases. So, to talk about Ganoderma, all of us need to consume Ganoderma for two fundamental reasons. One is to protect the health, and second is for medicinal benefits. All of you will agree with me that health is the most precious asset that one can possess. And all the four dimensions of health is required, including the spiritual health. But unfortunately, when you age only, you get that spiritual health. You don't get this when you are young. And the father of modern medicine, Hippocrates, said that let food be your medicine and medicine be your food. And Ganoderma is a very powerful food supplement which can act as a medicine. And every food what we take can become a poison. Excess amount consumption of salt, sugar, fat becomes a poison. That's a basic problem with us today because of the food what we take today. And all our food is contaminated with toxins. Even the water becomes a poison because we have a lot of chemicals present in water, and that leads to a lot of illnesses, diseases. And Ganoderma, talking about Ganoderma, it can never become a poison because there is no toxic element in that. It can become only a medicine. It has been used for more than 5,000 years. There are more than 400 active ingredients which make the Ganoderma so powerful in therapeutic benefits. And those 400 elements are classified under four major headings: triterpenes, ganoderic acids, polysaccharide, adenosine and organic germanium. And we'll be talking about some of the medicinal benefits of Ganoderma. But the primary focus will be on the prevention. So when you want to prevent diseases, as I said, the various actions of Ganoderma has to be there. And these four powerful effects of Ganoderma give us that help. The antioxidant effect, one of the most powerful effect of Ganoderma, the immunomodulating effect, the vasodilating effect, and the detoxification function. And Ganoderma is the most powerful antioxidant known to us. And we cardiologists, we prescribe antioxidants regularly for primary prevention or even secondary prevention. And even the statins what we use, they have antioxidant effects. But statin has its own side effects. And one of the Mayo Clinic professor, David Gomes, he says that antioxidant, that's statin, should be in our drinking water. He goes to the extent of, saying that message. But unfortunately, statins can be potentially toxic. But the beauty of Ganoderma is that it cannot be a toxic, and it's very powerful at an antioxidant. It is 5 times more powerful like ginseng. And antioxidant activity is measured in terms of ORAC, and that is the oxygen radical absorbent capacity, and that the antioxidant activity of ginseng is around 5,000. Ganoderma is very powerful, 5 times more powerful, and the antioxidant activity is almost 23,000 units. So making it the most powerful antioxidant, so that it's very powerful in protecting us from all the ill effects of free radicals. And the free radicals are highly toxic substances which can lead to deadly diseases. It can cause cancer, it can cause premature aging, it can cause arthritis, heart disease, heart failure, kidney failure. So the oxidative stress is taken care of by consumption of Ganoderma. And in terms of vascular disease, the free radicals can promote the deposition of oxidized cholesterol in the arteries, leading to heart attacks or other vascular diseases. And Ganoderma is a powerful antioxidant which can prevent that cholesterol deposition, and it can offer vascular protection. And today, we know that our health is primarily dependent on good blood vessels and blood flow. If your blood vessels are healthy, you remain healthy. If your blood flow is good, you remain healthy. And Ganoderma is such a powerful antioxidant, it can protect our vascular system. As I mentioned, Ganoderma can postpone the aging process, because aging leads to disease. As a powerful antioxidant, it can postpone the aging process, it can prevent cancer, can help in cancer prevention and also in cancer treatment. So for prevention, Ganoderma is the most powerful antioxidant known to us. The second effect of Ganoderma is by acting on the immune system. It modulates our immune system, increases our immunity by increasing the interleukin 1 and 2 and interferon production. And for good health, for protecting us from various infections, we need a good humoral and cell-mediated immunity. Ganoderma can increase both humoral and cell-mediated immunity. Vaccines are not going to be the answer, because, as Professor said, every second, new virus or a bacteria is emerging, and they are ready to attack us and kill us. And to develop a vaccine, it takes so many years. And to get a drug, it takes about 10 years. And so much of money has to be pumped in. To develop a new drug, you need to have $1 billion US. The average expenditure, money involved to produce a drug, a new drug, is around $1 billion US. Tremendous amount of money. So, drug cannot be the answer. So, Ganoderma, by acting on our immune system, it definitely protects us, especially children, immunocompromised children. Basically, the immune system is down because of malnutrition, undernutrition. And ordinary infections kill so many hundreds and thousands of children in this world. The childhood mortality is so high. We should be ashamed of that. No pregnant woman should die. No nursing mother should die. No child should die. I don't know when that time will come. So, we are killing our own children. So, where is the answer? Better nutrition, better immunity. And that can be given by spirulina and Ganoderma. And Ganoderma is the most powerful immunomodulator. So I said, if you need a good health, you need a healthy blood vessels. And the healthy blood vessels are primarily is by protecting the blood vessels. And in Ganoderma, you have two powerful components, adenosine and guanosine. The The natural adenosine is there. And when I finished my DM cardiology, 1985, Dr. Gangwal should be much senior to me. I never imagined that injection adenosine will be available as a drug. Today, injection adenosine is the drug of choice for paroxysmal supraventricular tachycardia. It's a molecule which is present in every cell, the form of ADP, ATP. The energy what you require, it has to provide. The adenyl cyclase has to provide. So, the high energy phosphate bond, when it is released, you get from the adenosine molecule complex, you get that energy. And adenosine by itself is a powerful vasodilator, especially on the microcirculation. So, this natural adenosine is present in Ganoderma. Another component is guanosine. This is also a powerful molecule. So both adenosine and guanosine help to protect the microcirculation and increase the microcirculation. That's one of the fundamental mechanisms by which it protects the vascular system. As you age, your blood flow decreases. And that leads to the aging process and disease. So if you need to be healthy at any age, especially in the old age, you need to protect your blood vessels, you need to increase your blood flow. And that is the effect which is done by Ganoderma, because we do not have any medicine to increase the blood circulation from head to foot. Maybe that we have some drugs to increase the brain circulation or the circulation to the heart, nitrates. But today we believe walking is the best medicine, because walking increases the blood circulation, the blood flow, and heart is a tremendous organ with so much of reserve capacity. It can pump 30 liters of blood every minute. 30. So, when you need good health, you need blood flow, good blood flow, and good oxygenation, good nutrition, and that is done by the powerful herb Ganoderma lucidum. In disease situations, Ganoderma can help so many disease situations, because, as we said, it contains more than 400 active ingredients. And with drugs, when you consume Ganoderma, you get additional benefits. Drugs are toxic materials, medications. Poison in small quantities will become medicine. When you consume more medicine, it will become a poison. You need to be extremely careful. Now, the present scenario is, we misuse drugs. That's one of the big problems. Especially in India, where you can get any medicine over the counter. You don't require a doctor's prescription. So we need to be extremely cautious. Do not misuse drugs. So you need to take drugs only under medical supervision. And when you consume Ganoderma along with drugs, you get so many benefits. The potentiating effect, the additional medicinal benefit what you derive out of Ganoderma. And this is one of the powerful benefit what you get as the pain killing effect, the anti-inflammatory effect. The polysaccharide fraction of Ganoderma is very powerful as a painkiller. And a lot of people misuse painkillers. And today, we are facing a very difficult situation because of the toxicity of the painkillers. A lot of people come with kidney failure, liver failure, bone marrow depression, why even heart failure. They can bleed somewhere. I have experience of, bad experience of having patients having bleeding in the brain for just, 75 milligram of aspirin. Low dose aspirin, what we routinely prescribe. Basically, there is no safe painkiller. All the painkillers are potentially very toxic and dangerous. So you need to have a natural painkiller. You have two products in DXN which can take care of your chronic pains. Of course, if it is an acute pain, you need analgesics, you need some kind of an anti-inflammatory drug or an injection. And the chronic pains, they are the things, they disturb you. And being a powerful anti-inflammatory agent, Ganoderma can do that job. And Morinji is a very powerful painkiller. You have scopolamine as a component, which is a anti-inflammatory substance. It's a COX-2 inhibitor, specific COX-2 inhibitor, Morinji. So when you combine Ganoderma and Morinji, you have excellent pain-killing effect. And the added medicinal benefit of Ganoderma being an anti-inflammatory agent, it can be useful in inflammatory disorders of the brain, especially Alzheimer's and Parkinsonism. So, Ganoderma is a natural painkiller with 100% safety, especially for chronic pains. Another powerful effect of Ganoderma, the medicinal benefit of Ganoderma, is as an anti-cancer. It was discovered in Japan in 1977 that Ganoderma has got anti-cancer effect. Many of the components of Ganoderma, they have anti-cancer effect. And today, for cancer, we use these three modes of treatment: radiation, chemotherapy, surgery, paclitaxel, docetaxel. There are so many drugs which are basically derived from plant kingdom. And 70% of allopathic medications are derived from nature. We use a drug called digoxin for 300 years for heart failure. There is no drug till today for heart failure, which is a plant product, which is obtained from foxglove, digitalis purpura. So, for cancer treatment also, there are so many drugs which are basically plant alkaloids. And Ganoderma, being a very powerful anti-cancer agent, it can help in cancer prevention as well as cancer treatment. And my first experience was with a blood cancer patient, monocytic leukemia, a young girl with monocytic leukemia. That was way back in 1999. One Miss Rajini, school teacher. That time Dr. Clarence, Dr. Ratna's classmate only, introduced the Ganoderma to me. Both of them were classmates in Mysore Medical College. It happened before DXN business started in India. And she had a miraculous recovery. Then only I started reading about Ganoderma and I understood this is a very powerful herb. And that time only it struck me that, I am digoxin day in and day out for my cardiology patients and cardiac failure patients. And of course, in 2000 the business started. And even before that I became a temporary member. I sponsored my classmate, Dr. Tangaraj, my roommate. And it has grown as a big dinosaur's leg. It's all decided by him. And today, a lot of my colleagues are joining DXN and I have seniors joining me, a lot of medical people joining me. Because they are all making fun of me in 99 and 2000. Now they are joining DXN. So they have also become wiser. So we need to understand that health is very, very precious. I always say 3 things, you should avoid. You should not go to 3 places. Don't go to a police station. Don't go to a lawyer, court. Don't go to doctor. Especially cardiologist. Because they will put in all sorts of, gadgets. We put stents, 3-4 stents. And the bill will be, huge one, 10 lakhs. Then we put ICD. About 2 weeks back, I put a ICD for one of my patients. It costed 7 lakhs, sir. And with the anti-failure, the mode, that additional, this thing, it costs 10 lakhs. So that guy is going around with the very precious, ICD. That is intracardiac defibrillator. So, if you want to protect your heart, take Ganoderma. Don't go to a cardiologist. You should never go to a cardiologist, right? It's a very powerful anti-allergic agent. Lenaston, linxeate, cyclooctasulfur, many components, they act as anti-allergic. Today, allergy is a major problem. we use so much of chemicals, and we use lotions, creams, pesticides, hair dye, very toxic compound, contains PPD, polyphenol diamine, which can cause cancer, which can cause severe allergy. It can affect your vision. Be careful when you use hair dye. I never use hair dye because hair being black does not give you health. It's a vestigial organ. It's not required, right? So be careful in using such toxic chemicals. Since we use a lot of these chemicals, allergy is an expression of many diseases. Can be skin allergy, nasal allergy, any kind of allergy, bronchial allergy. So allergy is a very common disorder, and even though we have antihistamines, they themselves can cause allergy. So here you have a very safe anti-allergy, Ganoderma. So it can help in very many allergic situations. Another important medicinal benefit of Ganoderma, as far as the cardiologists are concerned, the ACE inhibiting effect, angiotensin converting enzyme inhibiting effect. The ganoderic acid group of components, they reduce the blood pressure by ACE inhibiting effect, and this ACE inhibiting effect also helps the heart to pump better. It increases the contractility. So it can be very, very useful in reducing the stress on the heart. Another important medicinal benefit. And to talk about blood pressure, young people are becoming more hypertensive today. I see people with 20 years, 25 years, they become severely hypertensive. 120 diastolic, 130 diastolic because of obesity, excessive consumption of salt, stress, especially people working in IT. And this blood pressure kills a lot of youngsters. I always say diabetes takes 40 years to kill a person, but uncontrolled blood pressure will kill a person in just 5 years. Just 5 years. And it is said that 1 billion people will die of heart disease in 21st century. 1 billion. Almost 1/6 of the population. And that too many youngsters, especially developing countries. So it's very, very important that youngsters should take care of their health, especially their heart. Because a lot of young people are going to die. It's inevitable. And it is said many youngsters will not celebrate their 40th birthday. They'll be dead and gone. So, as DXN members, we have a very responsible job to do that, to educate young people so that they become health conscious. It's a great service. Because being a cardiologist, in all our conferences, we discuss only this: how to protect the youngsters. Many will not celebrate, as I said, the cross 40th year. And if you get into ICU, cardiac ICU, a lot of people will be below 40 years. Because the heart disease strikes at that age only, between 30 and 50. Once you cross 50, 55, almost many will cross 70 or 75. Because coronary artery disease, the maximum toll is in that age group only, between 30 and 40, 45, 50. So, it's very important that we need to take care of this problem, high blood pressure. And today the blood pressure, the normal blood pressure is 120/80. No more it is 140/90. No. Those days, about 15 years back, we said that 160/90 is fine. 140/90 is fine. Now today we said 120/80. Nothing more than that. So we need to cut down on salt. As Indians, we take 3 to 5 times more salt. The WHO recommendation is 3 to 5 grams. We consume 15 grams per day, average. We like pickles, puppets, chips, all those spicy curries, everything goes with salt only. So Indians are prone for high blood pressure and heart disease. And added to that, diabetes. Young people are becoming diabetic. And to talk about the milk products, Professor was saying that consumption of milk leads to type 1 diabetes, which requires insulin. So be careful about consuming a lot of this milk, because they contain a lot of toxins, hormones, which leads to obesity. And it predisposes to a lot of these disorders. Only human beings, they drink milk after becoming older, right? No other, living animal drinks milk. Once they are weaned off from the mother's milk. So, of course, milk contains a lot of nutrition, the milk protein, other, the sugars. But unfortunately, the milk what we consume today contains a lot of these hormones and chemicals which can lead to a lot of diseases. And especially, talking about, the breastfeeding, they have analyzed the mother's milk, especially in Rajasthan, about 60-65 mothers. They have found high amount of pesticides and chemicals in mother's milk. Where does it come from? It all comes from the vegetables, the fruits, and the food what we take. That milk goes to the infant, the child. So child is exposed to such kind of toxic chemicals. So unless we take care of that, it's very difficult to, get out of this bad situation. So we must be very, very careful in taking these highly toxic chemicals and getting exposed to that. And salt becomes a poison and it elevates our blood pressure. Ganoderma helps to reduce the blood pressure. And it is a very powerful heart tonic. The ACE inhibiting effect can protect the heart. It can reduce the cholesterol and the triglyceride. Both elevated cholesterol and triglyceride, they lead to deposition of fat, cholesterol in the arteries. And today, the cholesterol level, the normal cholesterol level has to be below 150 milligrams. The days are gone, we used to talk about 250 milligrams and 180 milligrams. Today, the total cholesterol should be 150 milligrams. LDL, the good cholesterol, the good cholesterol should be more than 45 milligrams. And the LDL cholesterol, which is the bad cholesterol, should be less than 100 milligrams. Especially we Indians, we tend to have a very low good cholesterol. So basically Indians, we are bad people because we have bad cholesterol, very high bad cholesterol. So we need to take care of that situation. And Ganoderma is a very powerful food supplement which can reduce the cholesterol levels. And in cardiology, we talk about some of the parameters being lower. You say lower the better. Your body weight should be low. Your blood pressure should be low. Your cholesterol should be low. And low stress. There are a lot of factors, which can lead to heart diseases. And all those parameters can be addressed by Ganoderma. And Professor always used to say, you need to have little bit of more money to buy good things in life, to give good education, to give good food. And that, as DXN members, we are helping so many people to get that extra income so that they can educate their children better. That is my thinking. And it's a very powerful brain stimulator. It can increase the memory, brisk and active. It can make you brisk and active. And one of the important medicinal benefit offered is to regulate the sleep function. sleep is very important, and do not depend on sleeping pills. They can be very harmful in the long run. And Ganoderma can be an excellent regulator of sleep function. It's called as the herb of spirituality. It can increase your spiritual function, because spiritual health is very important, especially after the age of 45, 50. One need to have a spiritual. That's the fourth dimension of health. And Ganoderma is called as the spiritual herb. It can increase your spiritual health. It's very useful for diabetic patients. Two specific components, Ganoderma A and B, can help to reduce the sugar. So it's the hypoglycemic agent, and along with the diabetic medications, you can have a better control of diabetes. And it's also an insulin sensitizer. Directly, it can increase the insulin production also. So my experience is Ganoderma is that many patients will be able to reduce their drug dosage levels. And I've even seen people giving up insulin after 2 to 3 years of regular consumption of Ganoderma. Not going to be immediate, but the ultimate benefit one can get in having a better control of diabetes. And it's also very powerful in controlling some of the complications of diabetes, non-healing ulcers, diabetic neuropathy. My mother had diabetic neuropathy. I put her on gabapentin, other group of drugs she was not able to tolerate. And for the past 5 years now she is taking Ganoderma at the age of 78. So it's a very powerful agent for diabetic neuropathy, because many of the drugs cannot be tolerated, and it's a very distressing complication of diabetic disease. And 10% of diabetic patients, they have this complication. There's no effective medication for diabetic neuropathy. So diabetic people can get multiple benefits by consuming Ganoderma. It's a very powerful liver tonic, heart tonic, brain tonic, and kidney tonic. And the powerful component is organic germanium, which gives that protection. The detoxification function, of course, that is unique to Ganoderma, because whatever we eat today, consume today, is full of toxins, including that bottled water, contains traces of chemicals. So we need to detoxify ourselves, and the kidney and liver, they do that job. You have another powerful herb, Ganoderma lucidum, which has a specific function of detoxification. So when the toxins are removed, your health is protected. It regulates various organ function, and especially addressing the infertility problem. It can balance the hormonal status, because many couples, they have the problem of infertility. It is said that 1 in 3 newly married couples, they may have the problem of infertility, and many of them, the problem is due to hormonal imbalance. And Ganoderma is able to address that issue, and a lot of Gano babies are born. The past 10, 11 years in India, at least there should be more than 1,500 cases of babies born due after consumption of the Ganoderma. Rishi is a powerful regulator of various organ function. The ultimate function of Ganoderma is that regeneration function. Aging process is primarily dependent on two fundamental changes. One is reduction of blood flow, and second is the loss of regeneration function. We are unable to regenerate the cells. So there is a cell loss from every organ, from the brain, from the heart, from the liver, from the kidney. So if only we have the power of regeneration, we can postpone the aging process and postpone the disease process. So Ganoderma has got that power of regeneration, and this function can help us in the old age to protect our health. It's a very powerful adaptogen. An adaptogen, by definition, it should be absolutely non-toxic. And if you see on the RGGL capsule, it will be put as non-toxic, absolutely safe, completely safe. But only poison sells more all over the world. Tobacco and alcohol. So it is a very sad situation. And Ganoderma is the most powerful adaptogen. You have about 13, 14 adaptogens. Spirulina is an adaptogen. Moringa is an adaptogen. And Ganoderma is called as a king of adaptogens. And when you consume adaptogens regularly, your health is protected and you can prevent diseases. It's a very powerful anti-stress herb. And stress is a major risk factor for many of the diseases, including heart disease. Because by calming the mind, it can reduce your stress. And Ganoderma is a very powerful anti-stress herb. So in preventing diseases, especially lifestyle diseases, where stress is a major factor, it can help us. As far as the heart is concerned, it has got multiple benefits. It increases the blood supply to the heart. It's an antiplatelet agent. It's a vasodilating agent. It has got the ACE inhibiting effect, by which it can reduce the blood pressure and protect the heart. And it can act as an anti-diabetic agent, because diabetes is a risk factor for heart disease. High cholesterol is again a risk factor. It can modify these factors and also the stress. So multiple benefits can be derived by Ganoderma. Although we talk about the pleiotropic effects of statins, statins cannot do all this, the job. It's a very powerful cardiotonic, and for prevention of heart disease, in my opinion, I think this is a very powerful food supplement. And how much to consume? Very simple, just one pair, one or two pairs. One pair of RGGL will cost about 20 rupees, whereas an apple costs about 25 rupees. It's full of pesticides and chemicals and wax. And when you consume apple, you end up, having stomachache. We have the, mind to buy apples, but not Ganoderma. When we say, as Professor said, costly. And Dr. Ratna always used to ask, compared to what? If you think health is cheaper, don't consume DXN products. That's the message what we should give to our family members, our friends and colleagues, and when you want to promote this, our DXN products. Health is not cheap. Health is something is very, very precious. I always used to say, you can buy anything in this world. You can buy your father, mother, any number of wives, diamonds, gold, but you cannot buy health. Health is something you have to protect yourself. But a lot of learned people won't do that, including doctors. They smoke, they drink, and ultimately they end up in ICU. They have plastic surgery, CABG. At least 15 of my classmates, Prithirajan knows. So doctors, they misuse their health. And it is, today the trend is doctors, they prescribe unnecessary medications also. Too many medications. I used to see our professor's prescription, maybe one or two drugs, not more than that. Today, doctors, they have a big list of drugs on both sides of the prescription pad. 2-3 painkillers, 2-3 multivitamins, 2-3 antibiotics. It's called as a shotgun therapy. One drug or the other will work. Today, that's a trend. Also, drug companies, they take care of the doctors to promote the drugs. One of the most corrupt industries is pharmaceutical industry. So, So we need to understand the limitations. I'm talking about the limitations what we have. I'm not saying that drugs are bad. I'm not saying that allopathy is bad, but we have limitations. So how to overcome that? So we should become wiser to protect our health so that we do not become patients. We don't want our family members to become sick and patients. So we must use drugs very, very judiciously. We should not misuse drugs. That's very important. At the same time, my request is, pass on the message to your friends and relatives that they should have regular checkups. Especially, ladies, because there is a tremendous increase of breast cancer, cervical cancers, ovarian cancers. So you need a regular mammogram, pap smear, because WHO is focusing on that only. Women's health. WHO doesn't have any separate program for men, because WHO knows that men will not listen. They will smoke and drink, except DXN members. But I see a lot of DXN members also smoking. They will do everything. Whom are you cheating? You are cheating yourself. You are cheating yourself. So when you say something, when you do something, you need to be the first example. You should consume DXN products. You should follow what you say. Then only you will be accepted as a leader. So let us, first practice that, and let us first make our family members to consume DXN products. I always say DXN products should be on the dining table, not puppets, pickles, chips and other items, poisons. All those poisons should be away from the dining table. So we need to set an example for ourselves, and just consuming 1 or 2 pairs of RGGL is going to give all those health benefits. And for a sick person, he needs more Ganoderma, probably about 3 to 6 pairs of RGGL. And only in cancer, you need to have a high dosage so that it will have that anti-cancer effect. And today, worldwide, a lot of cancer patients are benefited because of consumption of Ganoderma, along with other medications or treatment modalities. As I mentioned, radiation, chemotherapy, surgery. For some cancers, we do not have any medicines, any treatment. Pancreatic cancer, sarcomas, some of the rare tumors. And even today, pancreatic cancers, the longevity can be more. As Steve Jobs, he lived up for 7 years. Previously, we used to say, patient cannot survive more than 2.5 years when he is diagnosed of pancreatic cancer. Today, because of better treatment, better medications, surgical techniques, maybe that the life can be extended. But best is prevention. Prevention. So for prevention, food has to be a medicine, and nutrition has to be medicine. So both powerful products are with us in DXN, and Ganoderma can be very useful for cancer prevention. So food definitely has got a great role to play in maintaining our health. And not all food can be taken. Because for a person with diabetes, sugar becomes a poison. For a person with kidney disease or heart failure, salt becomes a poison. But Ganoderma can never become a poison. It will act only as a medicine. And when you go through the websites and literature, you have enormous research material available on Ganoderma. It's quite unfortunate that we allopathic doctors, we do not have any knowledge about Ganoderma, and we refuse to believe. And I was lucky in knowing about this Ganoderma, thanks to my sponsor, Dr. Ratna and Professor Vaspalaya. And being in DXN, my lifestyle has totally changed. I'm relatively free man now. I can take off from my routine practice. And because the DXN income is supporting me. And that is without my knowledge, that DXN has a double diamond, I'm getting a good residual income. Otherwise, I have to work. And I resigned at the age of 49. I was a professor of cardiology in Ramchandra Medical College. And 12 years back, I resigned. And after that, I never got into any of the medical colleges or for a job. Today, the offer for a teacher as a professor of cardiology in Tamil Nadu is around 3 to 5 lakhs. Easily. But I am able to resist that because I don't want to work under somebody, folding hats. At least that partial freedom the DXN has given me, and I am able to travel, and make a lot of friends. And one of the biggest, the asset what I have created in my life is, lot of friends. Money, of course, my grandfather has given me, my father has given me. And I was sharing with Dr. Gangwal that my father was one of the senior cardiologists, pioneer cardiologists in India, along with Dr. K.K. Date, Sujai B. Roy, Dr. Padmavati, and my father. So I was lucky to be born as a cardiologist's son. Not with a silver spoon, but with a golden spoon. But in DXN has given me another different kind of opportunity, totally new, and I enjoy doing it every minute, every day. Initially, I had a lot of hurdles from my own family, my mother, my wife. And today, all of them are supporting me, including my mother. People who are now, know me, like Dr. Ratna and the professor, or Nemi or Killi, they have all come, Dr. Ethirajan, And it took me 10 years to convince Dr. Ethirajan. I know. He is my very close friend and 2 years senior to me in the college. And he is promoting Ganoderma now very seriously. Because it's a question of, understanding the power of Ganoderma and the concept behind it. So Dr. Lim Sujan has given us, all of us, an excellent, an opportunity to promote health to our family members and brothers and sisters at large. So we're all fortunate to be here to hear from so many experts. When we started, we never had such kind of training or knowledge, whatever. We all learned in a very hard way about Ganoderma and other products and DXN system and networking. And my guru, Professor Vaspalaya, in network marketing, he taught me a lot of things. And with that, that skill only, I could get people like Dr. Ethiraj. And tomorrow you will be hearing from him. Such a wonderful person, very senior person, highly respected person. And why all of us are here? Not for money, but we want people to get help. And that's a great cause. And such a senior cardiologist, he has come all the way from Pune. And it's a great social service what you can do through DXN. So I'm fully committed to DXN. But it's unfortunate that, I have to carry on my profession as a doctor. The moment I go to Chennai, I have to become a cardiologist and I have to do all my professional work. It's something like, managing 2 wives. Very difficult. I always say that cardiology is my first wife and DXN is my second wife. Because that level of commitment, I have towards DXN, and the values what Professor and Dr. Ratna have taught me, I must be grateful to them. And recently, I had been to Pune, sir, for this Ayurvedic conference, World Ayurvedic Conference. I had a half an hour session, talk on Ganoderma. And I called the country manager, Guptaji, and said that my wife is undergoing surgery. It may be difficult for me to go to Pune. He said, Doctor, there's a big conference. I would appreciate if you can just make it for a day. After that, I was supposed to go to Mumbai. I said, then somehow they caught hold of Ajay Ramani, and he was able to substitute me for Mumbai, right? I was just there for a day. Just one night I gave the lecture and came back, because that level of commitment, I have towards DXN, and that commitment came after 10 years of long association with DXN and whatever my mentor has taught me. It's all a nice feeling to be in DXN, and especially what Professor is doing through Vasapal creation is something tremendous. And I don't think in any other network a leader will do that so selflessly, with so much of sacrifice. And any number of times I have told both the doctor and Dr. Ratna and Professor Vaspalaya, don't stress so much, sir. You have a great future in DXN. People who are just starting, people who are just, trying to learn, build their network. They have a great future. And my thinking is the growth of DXN from now is going to be very, very fast. Those who sincerely build DXN business. Because we struggled for 10 years, 11 years, to get that kind of a leverage. Now, you have all the expertise, all the information, the system, the powerful system, and I want you to use that knowledge and information about the products and the network, and I'm sure that all of you will become Crown Ambassadors. Thank you for patient hearing. Thanks a lot.